Hello everyone. Today I'm going to be going over a common argument against Medicare for all and seeing how it stacks up. This argument is shared and spread by quite a bit of conservatives online, including but not limited to the likes of Ben Shapiro and Steven Crowder. So let's dive into it. The argument is essentially that Medicare for all or any more socialized Medicare system will cause a drop in physician pay, which would lead to less people becoming doctors and therefore a doctor shortage. A good representation of this argument is an article from heritage.org from Dr. Robert E. Moffat titled "How Medicare for All Bills Will Worsen the Doctor Shortage." He explains how doctors have a lot of student loans in the US, stating the mean medical school debt to be about $195,000. He also shows the particular shortage of doctors in the US and states that accelerated retirements, job-based burnout, and growing demoralization fuel that downfall. Now, I want you guys to keep that sentence in mind because it's actually really important, and we're going to get back to it later. So, to sum it up, his key takeaways say that number 1, Medicare for all sounds good to most Americans until they take a closer look to how it actually works. Number 2, American physicians earn a much higher average than Canadian and other countries with socialized medicine. And number 3, combining mammoth pay cuts with abolition of private sector alternatives would not only hurt morale, it would accelerate the shrinkage of the medical workforce. Well, there you have it. Seems to be a good argument, right? That a socialized Medicare system will cause doctors to have significantly less money, cost much more for the government than the current system, lower doctor satisfaction rates, and thus cause a giant doctor shortage. So, you should probably vote for Trump, right? Well, hang on there a second, because upon further investigation, it seems like everything in that last statement is completely false. First off, if the notion is that a socialized Medicare system will cause much less doctors, then we can kind of estimate this claim by comparing the US doctors per capita with other first world countries with more socialized systems. So, when looking at it, we can see that the US actually has one of the least amount of doctors per capita, only with Canada slightly behind, whereas most of the other countries seem to be much ahead. Now, I understand that the US is not entirely the same as the other countries. However, can we really say with such conviction that socialized Medicare will cause doctor shortages when almost every other country with socialized Medicare has much more doctors per capita than us? I know a common response of conservatives is to point out the homogeny of these countries as if it means anything. I mean, I understand the general concept, I guess, of human beings feeling a bit more comfortable with people who look like them, but I haven't seen any proof of how homogeny, particularly of a race, in a society somehow drastically affects how the healthcare system works. It seems like just a throwaway statement conservatives use that doesn't really have anything to do with the topic at hand. Anyways, when we look at the satisfaction rates of doctors and comparing them by country, we can also see that the US is lagging drastically behind in this category as well, with 31% feeling dissatisfied. Now, these facts alone don't necessarily prove anything by itself. I mean, there could be other factors that play a huge role. So in order to see if privatized healthcare is the cause of this, we have to take a look at why the satisfaction rate is so low and if we can attribute it to our current system. So, when looking at the 2012 Commonwealth Survey, which included over 8,000 participants, we can see that a majority, way more than any other first world countries, doctors report that their patients often have difficulties paying for care in the US, and that insurance restrictions on treatments are a major time concern. In this graph, we can see that literally only 15% of doctors say that the current system is well. Okay, remember that sentence before? The one that Dr. Moffat put so eloquently in his article? Specifically the part where he talks about job-based burnout and growing demoralization. It seems pretty likely that the burnout is caused by the insurance restrictions, and demoralization might be attributed to having their patients constantly not being able to afford to get the treatment they deserve. And by the way, the physician pay is also misleading in this article. It even mentions how much more student loans doctors have, whilst ignoring that most other countries don't have this problem because they have a more socialized education system as well. Bernie Sanders' College for All Act aims to eliminate undergraduate tuitions, enact student loan and work-study reforms, all of which will significantly lower the pay difference. Another point to keep in mind is how much we currently spend on healthcare. When looking at the GDP per capita and comparing it to the healthcare spending per capita, we can see just how much more we spend. A study that a lot of conservatives like to parrot was one that showed that Bernie Sanders' plan would cost $32 trillion over 10 years. What they probably failed to tell you, however, is that the plan would literally save more money than the current system that we have. So while the price tag for the federal government will increase, the total cost will go down. Also, it probably doesn't hurt that millions of Americans will be able to get access that they otherwise could not afford, and that 45,000 Americans won't be dying from not getting the treatment they deserve. Just a small bonus that we can get out of all of this. Anyways, that's about it for the video. If you want to see any of these sources themselves, I encourage you to go to the description as I have all of them laid out. If you have any questions, comments, or concerns, feel free to tell me. Anyways, that's about it for this video. I will be signing off. Bye-bye.